The UK Ministry of Defence publishes a document on the 13th of May 2021. This is a direct quote from the document. Governance is unable to keep pace. They knew the law could not control what they were building, but they wrote it down anyway. 3 years, 1 month and 1 day later, the HSE put a hospital in your bedroom. This is the paper trail from that sentence to your house. And when you see how they done it, you will understand one thing. You are no longer a citizen, you are inventory. Here's the 9 documents, so let's begin. They told you the end goal, human augmentation, the dawn of a new paradigm. They define human augmentation as applying science and technologies to improve performance of the human. And the list of prerequisites, number 1, is the digitalisation of health. Not a hospital app, not telehealth, the digitalisation of health. Your biology turned into data. Why? Because you cannot update a human you cannot access. When we look at the other prerequisites, they are research, education, energy, which I will make separate videos about, and for the last one is security vulnerability. In a military paper about upgrading humans, the human is listed as the vulnerability. You, your privacy, your refusal, your body that can't be remotely patched, you are the security risk. And then at the bottom of the document, government is able to keep pace. This is a confession. This is the Ministry of Defence admitting that they are building a world law cannot regulate. This is not a white paper. This is a requirements document, and digitalised health is task number 1. Every other document for the next 3 years is a project update on task number 1. If you want to digitise a human, you need 2 things first. You need to get inside their house and you need to keep them there. In June 2021, Healthy Age Friendly Homes Programmes launches in Ireland. What does this do? I'm quoting here. Local authority coordinators will enter the homes of people over 65 to assess health, housing supports and technology supports. That's the end of the quote. They went national in 2023. So for thousands of years, your home was sovereign. No one could enter. The state needed a warrant. Now they send a coordinator to help. This is called jurisdiction creep. The normalised state agents crossing your threshold not to arrest you, but to assess you, to log your body, your meds, your Wi-Fi. And on March the 18th, 2022, the International Energy Agency published a 10-point plan to cut oil use. Sounds green, doesn't it? Read the actions. Point 1 is to reduce speed limits on motorways, lost by at least 10 kilometres per hour. This is to restrict movement. Point 7 is to work from home up to 3 days a week where possible. This is to isolate people. Point 10 is to digitalise public services and make them free. Also car-free Sundays in large cities. This is not an energy plan, this is a behaviour compliance plan. You cannot run a remote medical panopticon if people are at work, in cars, in community. You need them atomised at home, dependent on digital access for work, money and care. So phase 1 is done. 2021, the breach to home. 2022, the train you to stay in it. You are now physically accessible and behaviourally conditioned. Now you need one system to rule us all. So on June the 5th, 2023, the World Health Organization and the European Commission make an announcement. They are launching the Global Digital Health Certification Network, and they tell us exactly what it's built on, and I'm quoting here. The EU Digital COVID Certificate Infrastructure and Network, end quote. So the QR code, the app that decided if you could buy groceries or see your dying parent, the system you thought ended, it didn't end. It got a promotion. It's now the global backbone for verifying human health status. Every nation can plug in one language, one credential. The COVID pass was the beta test. This is 1.0 release. They took emergency powers and made them permanent architecture. Phase 2 complete. The cage has global bars. Now they just need to lock for your cell. A cage needs a lock needs a key needs a door to open. And on April 11th, 2024, EIDAS 2.0 enters into force with the EU Digital Identity Wallet Regulation. This is law, not a proposal, it's law. Article 1 says every member state shall provide a European digital identity wallet to every citizen by 2026. What does EU say it holds? I'm reading from their website. Your ID, your driving licence, diplomas, bank accounts, access, social security, proof of age and health data. Quote, it is a single point of access to public services. End quote. One credential to exist, one credential to be revoked. This is the legal body for the WHO's global network. The COVID cert was the prototype. This is the mandatory and before people start piping up to the digital wallet is optional and it's not mandatory. Ask yourselves this: if it's not going to be mandatory, why is it mandatory for every business in Ireland? They are forcing businesses to be able to accept and use this. So it's optional today, but it's mandatory very soon. Trust me when I say this. In 2023, Ireland piloted the digital wallet. So why so early, people ask? Well, because they knew what was coming and they want to be seen as global leaders in the digital side of things. On May the 21st, 2024, Digital Care for Care 2024-2030 was published. 40 days after the EU wallet became law, it mandates a patient app and national digital health record for every single person in Ireland. Virtual wards are listed as core service. I filed an FOI to the Data Protection Commission for the Data Protection Impact Assessment for virtual wards. It was acknowledged on the 21st of April 2026 and my decision is due on the 19th of May 2026. If a DPIA does exist, they haven't published it, and if it doesn't exist, they broke the law before they switched it on. On the 11th of March 2026, their master plan was published, AI for Care, the Artificial Intelligence Strategy for Healthcare in Ireland 2026-2030, Department of Health HSE. This is the document, this is the plan for your body. Look at the title, look at the date, look at the publishers. The Department of Health and the HSE now have a formal national strategy for artificial intelligence in healthcare running until 2030. The digitalisation of health from that 2021 MOD paper is now Irish state strategy in writing with their logos on it. On the 14th of June 2024, the HSE have a press release. New virtual wards to deliver hospital care at home, remote sensors on your body, algorithms decide if you're deteriorating, clinical pathways triggered without a doctor in the room. That's 24 days after the patient app was mandated. That's 64 days after the EU made digital ID law. Just stop and think about this for a second. 64 days. You cannot run virtual wards without a legal digital ID to cryptographically bind the sensor data to the correct human body. You cannot mandate a national health record without the wallet to log into it. The EU passed the law on the lock. Ireland had the key ready. They cut the file. They opened the door to your bedroom in 64 days. How do you scope, tender, build, test, train staff and deploy hospital care in 24 days? Either the system was already built before the law made it legal or they deployed it without completing safety steps. Which answer is worse to you? The phase 3 is complete. The lock is on the file and the file is open and the ward is live. This is not about healthcare. It's not about efficiency. This is about the engineered extinction of the human being. 4 things that have defined us for thousands of years are now gone. Consent. Under GDPR Article 7, the law of the land says consent must be freely given, specific, informed and withdrawable at any time without detriment. Look at the chain. EU law mandates the wallet. Ireland then makes the wallet the single point of access. The wallet opens your health record. Your health record runs into virtual wards, your GP, your prescriptions. Now, can anyone answer me this? Can we withdraw consent? If you delete your wallet, will you lose access to your doctor, your medicine, your right to drive, your bank, your social welfare? This is not consent. That's a hostage negotiation. Consent is dead. It's been replaced with compliance. You now comply to exist. The foundational right to say no to the state has been deleted. In GDPR Article 22, we have the right not to be subject to a decision based solely on automated processing that has legal or significant effects on you. Trace the data. The MOD's end goal is augmentation, a fused biological digital system. The EU wallet holds your health credentials as qualified electronic attestations. That means machine-readable facts about your body. Virtual wards put sensors on you. Those sensors feed algorithms. The algorithms decide if you were deteriorating. It triggers a clinical pathway. A machine reads your biology. A machine makes a triage decision. A machine tied to your state ID. At 3 a.m. when you're asleep, no doctor, no nurse, no appeal. For all of human history, 2 places were inviolable: your body and your home. Your skin was your boundary. Your front door was your castle. The state needed violence and a warrant to cross either. They've just ended that. Healthy age-friendly homes ended the home. The state now enters to assess, to log, to inventory. Virtual wards ends the body. It places the legal and clinical jurisdiction of the hospital inside your bedroom. You now sleep inside the institution. You are naked inside the institution. You are at your most vulnerable inside the institution. The MOD called you a security vulnerability. In 2021, they were telling you the plan. The vulnerability is managed by removing its privacy, by removing its sanctuary. There is nowhere left to go where you are not inside the network. There is no off, there is no private. Your body and your home are now nodes on their system. Law. Now, this to me is the biggest one. Civilization means law comes before power. We agree on the rules, then we act. But on the 13th of May 2021, the UK Ministry of Defence wrote governance is unable to keep pace. They confessed in writing that they were building a world law could not control, and then they still carried it out. No DPIA published for virtual wards before launch. No referendum on whether we want augmentation. No national debate on fusing your ID with your health. No vote on putting a hospital in your house. They built the capacity first, then passed the ES 2.0 to make it legal. Power came first, law came second, to sanctify it. When power precedes law, you were not a citizen in a republic, you were a subject in a technocracy. The state no longer asks for permission, it issues software updates to your life. These 4 extinctions are not side effects, they are the product. The system is working as designed. It is organised, documented, legal replacement of the Homo sapiens with the now Homo updated. The user account with a body attached. Anyone can have a coincidence, only an operation has a critical path. Look at this for yourselves. May the 13th, 2021, MOD Doctrine Digitalise Health First. This is the mission statement. June 2021, age-friendly homes get physical access. You cannot digitise a body you cannot reach. That's dependency number 1. March the 18th, 2022, IEA plan force digital life. You cannot run remote systems if the people are not remote. That's dependency number 2. June the 5th, 2023, the WHO and the EC Global Network, they built the standard. You cannot have national systems without a global plug. That's dependency number 3. April 11th, 2024, the EU wallet law. You cannot assign data to a body without a legal ID. June the 14th, 2024, virtual wards went live. It opened the door 24 days after the file was created. From doctrine to deployment took 3 years, 1 month and 1 day. From EU law to your bedroom took 64 days. And national policy to live enforcement took 24 days. Let me just say that again, folks. 24 days. You cannot scope, tender, build, test or train staff and deploy a hospital level care system in 24 days unless it was already built. They were not developing it. They were waiting for the legal go-ahead. On the 11th of April, EDAS 2.0 made it legal. June 14th, they switched it on. This is not 7 different government departments having similar ideas. This is doctrine, access, behaviour, global standard, legal mandate, national database, in-home enforcement. Each level is dependency for the next. Each level waits for the one above to go green, then it fires. This is not policy. This is a military operation. That is the project plan, and you are the end point. So if you're wondering what you can do now, well, I reckon you've got 3 choices. The first choice is you can close this video and say she's crazy and go back asleep. But mark my words, in 2 years' time when you're looking to get your son or daughter an inhaler and you can't get into your digital wallet because you're after posting something online that went against community standards, or your mother's body sensors after flagging her for being non-compliant, you're going to remember this. You're going to remember this moment. Or you can understand. You can really start to understand that everything that's happening right now in our world is legal, and everything legal is written. So we can start using their own laws that they're breaking against us, against them, and start holding them accountable. You can write to the Data Protection Commissioner and tell him under Article 7 of the GDPR and Article 22 that you're withdrawing your consent, and invoking Article 22 of the GDPR and refusing to have your data shared on their platforms. Now I'll leave a little thing for people to copy and paste along with the email that they can send to the Data Commissioner. But you also have to realise these protest people are the Pied Pipers keep leading you on these protests, that the government are absolutely loving them and laughing at them, because every protest that these Pied Pipers call for, it creates more revenue for the government. People have to buy petrol or diesel or use public transport services to get to these destinations, which is more revenue for the government. And then when we do get the crowds and numbers that we need to start listening for the government to hear us, they're just going to invoke the only tool they have, which is their legal, which is when they send the state protectors, aka the guards, out to people, and innocent men and women get arrested and get brought to court. But we do have a real chance to actually make them hear us. And we all know government's taken up the EU Council presidency in June, or July of this year. I can't actually remember right now. But we have a chance for them to hear us now. I'm not talking about another protest. I'm talking about mass non-compliance. For the first 2 weeks of when they take up the EU presidency, we're going to have every little parasite from the EU Council over here in our country, which is going to mean more security. So if it's more protests on the street, it'll be more arrests. Or we could actually play them at their own game and we could shut the country down. Everybody phone into work sick for 2 weeks. Don't bring your children to school for 2 weeks. Don't go to work. Don't shop in their shops. Just stay home. They can't arrest you for staying at home, but it'll also make an absolute holy show of the Irish government to show that they've no control over their people, or will it'll also affect their revenue and the data. We switch off the internet for 2 weeks. They will. When we stand up, they will have to sit down and listen to us. This is the only way I believe we can get them to hear us. So the choice is yours, folks, because remember, what we allow will continue.